Welcome to Health Biz Briefs. I'm David Williams, president of Health Business Group, here with Health Universe founder and CEO Dan Caron. Dan, thanks for joining me today.
Hi, David. Great to be here.
So our topic today is about an open source platform for healthcare AI apps. Now, Dan, my first question for you is, what is an artificial pancreas and what do you have to do with it?
That's a great question. So I'm a type 1 diabetic and I participated in an open source group. We hacked the Omnipod insulin pump and we integrated that into a mobile phone application called Loop, and it automates the delivery of insulin up or down. There's tens of thousands of people that used it, and it really proved that an open source community can come together and create safe innovation in a disease state. And that application became the first sort of open source FDA approved medical application last January. My role, I was the reverse engineer. I sort of hacked the wireless communications, but there was a really great and large group of people that worked on everything from documentation to the mobile driver to everything. So it just shows that open source community can create real innovation in healthcare.
Sounds like when it's like Ocean 11 type of thing.
Yeah.
You got all the experts.
Exactly. Yeah. Yep. We had code names.
Yeah. This time for good. Great. Dan, what is Health Universe?
So Health Universe is a startup that I founded last year. It is a collaborative platform for health AI. I realized that there was no vertical aggregating health AI, and I wanted to build a platform that could bring data scientists and clinicians together and really create a sandbox environment to mature AI algorithms from prototype to stable to institutionally validated and even FDA approved. And really, it's an ecosystem for researchers and clinicians to mature these really exciting technologies.
How's it going so far?
Oh, great! We've received quite a bit of attention from our hackathon last year, and we have some really well-known cancer institutions deploying algorithms onto the platform, and it's super exciting. I want to live in a world where a clinician anywhere can run the most advanced breast cancer detection model right from the browser, because I think we need to figure out a way to socialize these really powerful tools for the world.
I've been hearing a lot lately about AI agents in general and in healthcare. Can you tell me what is an AI agent and what is the potential for them in particular in healthcare?
Yeah, so AI agents are going to take over the world in the next few years, and hopefully they will be kind to us. But effectively, what an agent is, it's an algorithm that can make decisions about the work that needs to be done. So you can imagine in healthcare, an agent might be refilling a prescription, right? And there may be different questions about that prescription, or there may need to be a prior authorization that needs to be done. And an agent would automate that process and sort of remove all of the decision elements that sort of hold up healthcare today. And on Health Universe, we're building medical co-pilots that remove a lot of these burdens at the moment. And they really allow for sort of a faster, more efficient future for healthcare.
Got it. I was going to ask you if there's a distinction between agents and co-pilot, which is another term that I've heard. You know, the way you describe the agent, it's a helper. Co-pilot, I think it's used that term is used that way a lot, but I also think about, co-pilot, if something happens to the pilot, they can take over. And I don't know whether the agent to do that. So I'm trying to actually get my head around that distinction.
Yeah, that's a great question. So co-pilots generally come from the generative AI world, the world of GPT-4 and Chat GPT. So a co-pilot is something that it's generally a chat interface, whereas an agent might not be a chat interface. An agent could be just making decisions autonomously around the clock about workflow that needs to be taken care of. Whereas a co-pilot is something that a clinician would be sort of interacting with, or a patient would be interacting with to get a job done.
Got it. So I can imagine an agent might be useful for something like prior authorization, where it's like, I don't really want to be around. It's like, you go deal with it.
Yes.
And you come back when it's dealt with, right? And a co-pilot might be, I want to explore my health and how I might change my fitness routine or something like that.
Exactly. Yeah,
Yeah.
perfect. That's exactly it.
All right. Well, I'll get that. I'll sign up for that prior authorization agent as soon as it's available. Great. Well, Dan Caron, CEO of Health Universe, thanks for joining me on Health Biz Briefs. If you like what you hear, check out my Health Biz podcast for a full-length interview with Dan about his life and career. Dan, thanks again.
Thanks, David. It was great to be here.